My name is Teitelbaum, and I'm an Associate Clinical Professor of Plastic Surgery at the David Geffen School of Medicine at UCLA. On behalf of my co-authors, John Diaz, the President of the Los Angeles Society of Plastic Surgeons, and Dr. Robert Singer from San Diego, I would like to thank the Aesthetic Surgery Journal for including our article on the safety of plastic surgery during the COVID-21 pandemic in its January 2021 issue. Like much of the rest of the country, in Southern California, we were stopped from doing all elective surgery mid-March. We all gradually returned to elective surgery by the end of May. During those months, there was a lot of concern about whether or not it would be safe to do plastic surgery during the pandemic. Would staff or surgeons or nurses get infected? Would patients who were destined to get COVID get worse cases? Would there be immune suppression from surgery? Would there be barotrauma from the ventilators? These questions were still unknown, and there were a few articles that raised some concern. The Aesthetic Society created a task force, and the task force created a number of recommendations. So armed with those recommendations, plastic surgeons in Los Angeles started resuming surgery in the end of May. Towards the end of July, over a 1-week period, we queried all the plastic surgeons in Los Angeles using a survey monkey. With 112 surgeons responding about their 8 to 9 weeks of surgery since they resumed, they responded reporting a total of 5,633 plastic surgery procedures. The preoperative positivity test for COVID was 0.69%, and the postoperative positivity within 2 weeks after surgery was 0.13%. No patients had a serious postoperative infection from COVID. None were admitted to the hospital, and there were no deaths. Similarly, we asked surgeons about their experience with injectables, and separately we asked them about their experience with plug-in-the-wall or energy-based therapies. With both of those, there were few mild infections after surgery with no admissions, hospitalizations, or deaths. We also asked about the spread within the staff, and there were no offices that had any spreads that were related to activity within the office, but rather some had infections, but they were tied to what occurred outside the office, and there were only a few within the office, but not with any major outbreak. On this basis, we concluded that it was safe to perform plastic surgery during the pandemic, provided all the appropriate steps were followed. Not only did we show that it was safe, but it just turned out in retrospect that the case collection period fell during a particular peak in Los Angeles, where LA County cases were skyrocketing with a high test positivity rate and a much increased prevalence of the disease, suggesting not only that we showed it was safe, but that it could be done safely even during a rise in cases. As I'm recording this today, the ICUs in Los Angeles are filling up, but the vaccine has also recently started being rolled out. So we realize that our paper has a limited longevity. We don't know how people will interpret the paper when we're vaccinated or when case rates go dramatically up, but this much can be concluded. For a public health safety officer or for a politician concerned about reducing the transmission of COVID, there's no evidence to support them curtailing plastic surgery as a public health policy position. In fact, we've shown that it can be safe to do the plastic surgery. So while we can't always expect our public health safety officials to operate on the basis of data, we should always push them to work on data. Because if the public loses trust in its public health policy officials, then the public health policy officials lose all power and influence because the public will have lost faith in them. So all plastic surgeons are encouraged to read up on the safety protocols from the Aesthetic Society, to read the article carefully because there are a lot of details and caveats about why we believe the data was so good and why we were able to operate safely during this time. In conclusion, I want to particularly congratulate the journal because this is their 25th anniversary. This is their Silver Jubilee year. And congratulations go to Dr. Nahai, Dr. Kankel, Phaedra, everybody at ASJ, including the past editor, Dr. Klatsky, and all of those who've contributed to it over the years. So here's to a great 2021 for ASJ and for years behind. On behalf of John Diaz and Robert Singer, thank you very much for listening to this, and we hope you enjoy our article.